Namaste everyone. Today I am Dr. Apeksha Bista, medical officer working in Poison Information Center. So today I am going to present on the topic Delphinium poisoning. In this presentation, we will discuss about its toxicity and management. So in this picture, we can see the different colored flowers. So this is how the delphinium plant looks like. It contains either blue, pink or white flowers, and it grows annually, and it is around 0.5 meter to 1.5 meter in height. So delphinium, it is also known as larkspur, is a part of Ranunculaceae family with over 300 species, and it has been recognized for its medicinal properties. But certain species can be highly toxic with effects depending on growth stages and concentration of alkaloids. So in Nepal, India, and Himalayan regions, so out of 300 species, mainly three species has been found. They are Delphinium brunonianum, Delphinium himalay, and Delphinium steppe liosum. This plant is used in the traditional medicine for fever, headache, jaundice, stomachache, and skin rashes. So their extract, like beta-amyrin, beta-cytosterol, exhibit antibacterial properties against various bacteria like Staphylococcus aureus, Pseudomonas, and E. coli. So about its toxicity, it causes alkaloid-induced toxicity. So it has diterpene alkaloids, which is similar to aconitin, that activates the voltage-sensitive sodium channel in myocardium, nerve, and muscles, leading to delayed depolarization and arrhythmias. So as per the mechanism, so the major toxic effects are neuromuscular paralysis, respiratory depression, and cardiac arrhythmias. But however, poisoning usually occurs in grazing cattle and is rare in humans. So mistaking the medicinal species or poisonous species may be ingested, leading to poisoning in humans. So upon the ingestion of the delphinium, the symptoms usually appear within 30 minutes to 2 hours after ingestion. And the initial signs may be sign and symptoms may be GI upset, paresthesia, muscle weakness, numbness, headache, and dizziness. And in severe cases, patient might develop convulsions, delirium, tachyarrhythmias, bradyarrhythmias, respiratory depression, and coma. And some of the literature uh, have reported acidosis, hyperglycemia, hypokalemia, and raised CK levels, as well as tetraplegia. Among all these symptoms, the predominant toxicity is cardiovascular, with major being tachyarrhythmias, that includes ventricular tachycardia, supraventricular tachycardia, bundle branch block, torsades pointis, and ventricular fibrillation. But bradyarrhythmias are usually less common, and when the toxic species is ingested uh, in fetal dose, death usually occurs within 12 hours of ingestion caused by hypotension and refractory tachyarrhythmias. So now we will go through the case which we encountered in our poison information center. So on September 3rd, we received a call from the TUTS ER department, where a 35-year male with all his history of ingestion of delphinium um, uh, for Ayurvedic purpose came, and the amount ingested was pea-sized, and time was 9 a.m. So we received call at 10 a.m. and the patient presented with the spasm of muscles of bilateral hand, which is usually unusual in case of delphinium poisoning. And he also gave history of 2 episodes of vomiting prior to the presentation. But at the time of presentation, his vitals were stable, and all the systemic examination, the findings were normal. But on local examination, carpopedal spasm was noted in bilateral hand, and all the other lab investigation were normal, except CKMB, which is 28. Um, Usually the delphinium, it causes rise in the creatinine kinase and AST level, but AST level was normal. CKMB was 28, which is slight greater than the normal range, because normal range is 5 to 25 international unit per liter. And before we received the call, he already received the injection calcium gluconate, Calvit, and vitamin C tablet and IV fluid. So in this case, since the vitals were stable, since we have discussed the various symptoms of the delphinium, like there might be the mild to the very severe symptoms affecting mainly the cardiovascular symptoms. So we advised regarding the monitoring of the vitals, mainly the cardiac rhythm and assessment of the pupil size. And hence he was kept under observation. And after the 24 hours of observation, he was stable and no other new symptoms developed, and he was discharged. And also recently also we called him and he was stable. So there are similar cases reported in the literature, like 17-year-old male with delphinium root ingestion who developed convulsion ventricular tachycardia and was treated with standard ACLS. Likewise, 13-year-old girl developed confusion and respiratory depression as well, and recovered within 4 days after treatment. And also the 80 years old male with delphinium poisoning developed hypotension, ventricular tachycardia, and he was treated with multiple DC shocks and vasopressor and discharged after recovery with no arrhythmia. So from all these cases, we can make the conclusion that the main standard treatment protocol in this case, in the case of the delphinium poisoning, would be monitoring of the general appearance of the patient, orientation and vitals, an assessment of the symptoms, and close monitorings for any kind of danger signs and symptoms, and symptomatic treatment is needed. Sometimes the patient might develop cardiac arrest, arrhythmias, bradycardia, hypertension, which is treated accordingly. And also the physostigmine and neostigmine have shown effectiveness in reversing the delphinium toxicity, especially in cattle. Since this poisoning is more common in cattle, there are many studies that is done in cattle, but also the use of this agent in human can be helpful, particularly in case of anticholinergic effects. So regarding the decontamination, like role of activated charcoal and gastric lavas, it can be and activated charcoal can be administered within 1 hour of ingestion, and gastric lavas may be considered for life-threatening overdose. Regarding monitoring and follow-up, it should be done like patients should be observed for at least 4 hours, and ECG monitoring, electrolyte assessment, and cardiac rhythm monitoring should be done, and the patient can get discharged if asymptomatic with a normal ECG. As for the treating physician, the ECG of the patient that we dealt with was normal, but however, we could not get the picture of the ECG. So as a conclusion, like take always massive. Delphinium poisoning, although rare, can be life-threatening with significant cardiotoxicity. Early recognition, supportive care, and appropriate intervention are essential for patient recovery. So these are the few references, and there are case report based on this poisoning, but and also the studies have been done in cattle, but in human the study are rare. So further study needs to be done. Thank you.